Welcome to episode 1 of Health Matters, a 13-part series presented by Trinity Health Systems where we look at different topics regarding high school athletes. For the first episode, we'll be looking at common injuries and to decide whether or not a player is hurt or injured.
Here at this practice is really unique. We see lots of spine, obviously, and extremities from common day injuries to I lifted a plate over my shoulder too. I hurt my back on the line last night. So we see lots of stress fractures and some disc herniations. So those are common things that people don't think that they have, and a lot of times those are pain generators. So that we use advanced imaging and stuff to kind of get to the bottom of that and kind of give them that solid answer and prognosis going forward. I think a lot of kids nowadays are overtrained, dare I say it, right? But what happens with overtrained is that it actually wears on the spine a little more than some other joints because those discs in your back need a chance to kind of hydrate, replenish the nutrients into the spine. And whenever you're chronically overtrained and compressed, those things kind of get shut down, those processes, and it leads to kind of long-term chronic stuff. So I usually try to have a conversation with them about that. A lot of times, by the time they reach our office, they actually have a true injury. There's a difference between being hurt and being injured. Too many times, parents might bring them in too late after, hey, my kid's had a back pain for a year and they've been sitting on a stress fracture for 6 months or a year. Those are really common overlooked injuries that can actually be easily treated conservatively. If back pain in a kid lasts more than a couple days or a week, then there's probably something more at play. Muscle stuff usually gets better pretty quick. That's what I tell a lot of my parents. But if it's been months or a year, then that usually means there's something else going on.
The most common injury you see with shoulders is it's called an AC joint separation, or some people call separated shoulder. And what it is like you can see the ligaments on top of there's your collarbone coming into the wing bone over here, and you see these nice big ligaments here, these brown on this model, that kind of hold the collarbone to the wing bone, and when you tear those, the collarbone will sometimes rise up a little bit, and it's sore and painful. A grade 1, where you just damage this top ligament up here, that's the more typical one, and the big thing is painful, and a lot of times you can't raise your arm up really well. So if you're a receiver or the lineman that you're blocking using your shoulder, it can be painful, so you can't play a lot of times because of pain. Is it dangerous? Probably not that dangerous of an injury, but could be really limiting. So you can pad it. There's different things we can do to try to get you back. Usually a lot of times it's a grade 1 in a week or so. And then the other big thing in football is a shoulder dislocation. That's where this ball comes out of the socket here, okay? And you can see that this is your ball and socket joint. And basically what happens there is the typical thing is a guy's got the ball on a kickoff a lot of times or something like someone breaks free, and you're running this way and you're turning to go get him, and you try to grab him with your arm, and your arm gets, and then the shoulder pops out, okay? Or the ball pops out. Sometimes too, I've had a couple, you get some of the female cheerleaders, and they're maybe 118 pounds wet, and they're picking up a bigger guy or a bigger girl, and they can and then they get an awkward position and the shoulder will pop out because the same thing, their arm is extended in a way, and that's the weakest position for your shoulder is when your arm's away. When you're in here, you got your pec muscles, your lats, your trapezius muscles, your big muscles that help stabilize the shoulder. But when you do this, those are out of play, and now you're just relying on your rotator cuff, and it isn't enough to stop the forces.
One of the most common injuries in sports is the MCL, which is called a medial collateral ligament. And the ligaments are like little ropes. You can see here they keep the knee. Some ligaments keep them from going side to side. Some keep it from going front to back. So the MCL, or the medial collateral ligament, is over here, and it keeps the knee from going inwards like that. So this is a right knee, and if it goes in like that, you can see how that stretches and tears the MCL. And that's very common in sports, especially in football. When someone gets a blow to the side and their knee goes like that, you can see that ligament will tear. Now, since that's outside the joint, you can see that usually heals pretty well. So it's very rare to ever need surgery for an MCL injury. If we look inside the knee, we can see 2 ligaments in the center, and those are called the cruciate ligaments, the ACL and the PCL. The ACL keeps the knee from going forward like that, and you can see in this knee actually the ACL is torn. and that's a ligament inside the knee. When that's torn, then the knee slides too much like that and twists too much. And sometimes we need a test such as an MRI to see whether that's torn. That's a much bigger injury. We all hear about professional athletes getting that surgery, and nowadays even high school athletes and everyday people who aren't even necessarily professionals need surgery for that, especially if you're younger, because once that ligament is torn, it tends to cause a cascade of problems that cause problems over the years. So especially in young athletes, we almost always recommend reconstructive surgery for that. There's also inside here, you can see these cushions. They look like little shock absorbers. Those are called the meniscus or the menisci. Those are often torn, and you hear about people having arthroscopic knee surgery for that. And that's also common in young athletes. It's common in people of all ages.
Usually any sport that involves cutting, pivoting is a very common sport to have injuries for the foot and ankle. The most common we see is the ankle sprain, where the ankle just rolls and twists over, and then there's a lot of swelling on the outside portion of the ankle. That's a very common injury. And it's easy to just see if you're getting better for a couple days. The swelling starts to go down, you ice it, you elevate it, you rest it, and if you get better, that's fine. If not, we usually see them maybe in a week or so if the swelling is not going down. And with ankle sprains, normal injury is at the ATFL, which is this X mark. So if you see the big bony bump on the outside of the ankle, the front part of that is where the ligament of the ankle attaches. That is the most common to be injured in an ankle sprain. If he has pain that's higher here, that's called a high ankle sprain, and it involves a ligament that connects the outside bone and the shin bone. You do not want to go back to sports if you hurt here. If you hurt there, it's okay to go back here. You want to get that evaluated. This point is called the lateral malleolus. That's the outside portion of the ankle. If you hurt directly on that spot, or similar medial malleolus on the inside of the ankle, then there's a high chance that you've had a very subtle or an important ankle fracture. Medial malleolus, lateral malleolus, two important ankle bones. This can get fractured either as a stress fracture and sometimes as Jones fracture, which is very common and people know about it. It's the base of a bone of metatarsal, which is a foot bone, and it makes walking really difficult. This is a very common injury with an ankle sprain. So the ankle gets swollen right there, but they have point tenderness right here, and that's a clear sign that you should not go back to sports because you may have fractured that metatarsal.
A lot of times, generally, swelling, the severity of the pain, and the ability to bear weight, if we just talk about the knee, are usually guidelines. In general, for a high school athlete, let's say, if there's pain, you don't play. Yeah, that's it. It's not worth the risk of making the injury worse. And with those other signs, the trainer can guide you as to whether you should continue or not. And if there's any doubt, we err on the side of safety.
And that's all for common injuries. If you have any other further questions, you can always contact your professionals at Trinity Health Systems. Until next week, I'm Stephen Ruffing.